everyone. Welcome back to Industries TV. You're here for our 5th episode. That's right, 5. I'm your host, CG Adams, and this month we have everything you need to know about healthcare and life sciences. Let's go ahead and jump into the teases.
Coming up, I'm going to tell you why Health Cloud is the solution for the next generation of healthcare.
Hey everyone, we're here outside of Chicago at MIMIT Health, one of the fastest growing multi-specialty independent physician groups in all of Illinois. And we're going to see how Dr. Chopra is caring for the whole person throughout the patient journey. That's coming right up.
And LaShonda Anderson-Williams has her list of the top 5 customer trends and priorities. Plus, how will winning organizations thrive in the anywhere age? Great question. Lynn Zaladonis will answer it on the Innovation Forecast. And of course, Jujar Singh will tie a bow on the show with the Meta Point. Our lead story for today comes from Dana Wolf, Senior Director of Industries Marketing. Dana, thank you for joining us. I heard that you have some amazing Care from Anywhere innovations to share with us today.
That's right, CG. You know, it's no secret that COVID-19 has accelerated the demand for an always-on, digitally enhanced health system. Patients, members, and care teams alike have come to expect convenient, personalized experiences everywhere, especially as access to traditional settings has declined. But the latest innovations from Salesforce Health Cloud empower healthcare and life sciences organizations to meet their customers where they are and to deliver the right care at the right time from anywhere. First, we have intelligent appointment management. It maximizes appointment scheduling efficiency by suggesting the right appointment, whether that's at home or in the office, to help reduce no-shows, administrative costs, and time spent on calls with a scheduler. Medication management helps health systems, pharmacies, small practices, retail outlets, and others manage medication lists regardless of where the care is accessed. And remote patient exception monitoring surfaces data and insights from connected devices directly within a single dashboard. This helps care coordinators create a personalized connection with patients, and all makes for better monitoring of health conditions, all without ever having to step foot into a provider's office. Here with a perspective on these features is Kevin Riley, Healthcare and Life Sciences General Manager at Salesforce. Kevin, welcome.
Thanks, Dana.
So, how do these advances help organizations initiate or accelerate their digital transformation?
We know structurally that the EHR is the fundamental mechanism for use when somebody comes in to a physical location. They get their diagnostic, they have their appointment, it gets coded into the system, they go forward. That doesn't mean that it's easy to get in, doesn't mean you're prepared when you get there, doesn't mean when you leave you've actually got some sort of digital helper. This is where Salesforce is focused. Our Care from Anywhere strategy really surrounds the EHR to make sure things like, well, appointment management, using intelligence in appointment management. If I'm not prone to show up on a Tuesday, the doctor wants to know so they don't book me on a Tuesday. If they give me something to take home, I want it digital format. I'm probably going to lose the piece of paperwork. In fact, they probably need to remind me to actually give it to my wife, who is the care coordinator of the Riley household. And think about if they give me something to take home that actually has some sort of automation behind it, maybe like an iWatch, and they're doing some readings. How are they getting that information back? So remote patient monitoring. All of these aspects surround what exists today in what we call the infrastructure of healthcare, but it's a very friction-filled environment. We're trying to create a Care from Anywhere frictionless environment.
HIPAA compliance for Salesforce Maps, B2C commerce, and order management collectively ensures the security of patient health information while helping organizations increase their efficiency in the field and deliver greater personalization to their employees and customers. Kevin, you could put these features to use in a number of ways, from supporting a home health worker and guiding them through an in-home visit, to making it easier for a medical device technician to service equipment or refill inventory in the field. How do you see industry leaders putting these products to use today?
Well, I can think of 2 examples right offhand. One is our health e-commerce solution that is live and running up for the FSA store. I mean, understanding how to pay for your benefits and making the best use of your time to digitally shop for ways to get more out of your dollar for your healthcare spending is the mission. And that's what we've done together. We've actually created an ecosystem of HIPAA-compliant commerce around shopping for those types of payment modalities for your payment for your benefits. Another great example is one of the world's largest payers uses us to do their mail order drug catalog. So if you go on as a member of this plan and you want to find a better alternative to getting the medications you want delivered to your home in a compliant way, well, there you go. These are the ways that we're removing friction from the system. As healthcare changes, that is really the driving mantra for us. Remove friction, make it digital, make it easy, care from anywhere.
Thanks for joining us, Kevin. It is so exciting to see how our customers are putting these products to use to meet changing expectations and deliver better outcomes in the process. With the Care From Anywhere solutions, they're creating a digital-first, patient-focused, more accessible future of health. Back to you, CG.
Thanks, Dana. To learn more about these amazing Health Cloud Care From Anywhere innovations, click on the link below. Coming up, we have a special report with Jason Martial, but first we got your top 5. That's right, we're cutting down the top 10 so we can keep things moving. Here's LaShonda Anderson-Williams.
Hi everyone, I'm LaShonda Anderson-Williams and I lead the Salesforce pharmaceutical sales business here. I am here today to share with you my list of the top 5 trends and priorities that we're hearing about every day from our customers across various pharmaceutical organizations. Number 5, embracing the digital world with healthcare providers, patients, principal investigators, and employees are just a few. The pandemic has spurred digital transformation to such an extent that some experts believe the biopharma industry has moved further in the last 10 months than it's done in the previous 10 years. It isn't stopping now. Number 4, rethinking patient services and how they're evolving to becoming more and more critical for pharma. Why is that? Well, programs are moving from point-based workflows focused on onboarding and access to really building more holistic models of engaging a patient. Patient centricity is moving to a whole new level. Number 3, innovations such as personalized medicine and other platforms are emerging at unprecedented speeds and are likely to have a major role in conquering debilitating diseases with high unmet needs. These new models are demanding new ways of thinking and executing. Number 2, adopting a new model for drug development and the need for virtualization of clinical trials has happened. Many organizations are experimenting with new ways to accelerate historical development timelines by 500 days or more. Advancements are happening faster than ever. And the number 1 trend is leveraging the right data to drive business value. IT has been a prime enabler of many of the changes that we've all seen in 2020 with expanded data sets and flexible access to cloud computing capacity. Managing data collection, volume, and transformational insights is an imperative. As we know, data is the new gold. And that's my top 5. Back to you, CG.
Today we've shown how Salesforce helps providers improve patient outcomes with the latest innovative solutions. But how exactly does that work in practice? Jason Martial hits the links with Dr. Chopra to find out.
Dr. Chopra is the founder and chairman of MIMIT Health right outside of Chicago, Illinois. He's a fascinating trailblazer because he truly believes in the idea of patient centricity, which allows him to deliver a superior patient experience. Dr. Chopra and I have worked on projects together over the last 4 years, demonstrating how Salesforce can help providers improve patient outcomes. But as much as we've worked together, we've never actually met in person. But that changes today. And over the years, we've talked about our mutual interest in golf, so we're gonna hit a few balls, we're gonna work on my slice, and talk about how he delivers patient-centered experiences. So we've known each other, what, about 4 years virtually now? And your favorite thing to talk about is healthcare at the speed of life. Tell me what that means to you.
Hey man, we're living this 4th industrial revolution. We're connected to everybody, everything. We buy stuff from Amazon and all these things, and healthcare is nowhere near there. So I said, how can we do it where we experience it just like we do the rest of life? We are connected to our patients. Patients text me, email us, connect with us. They can get their prescriptions delivered at home like Amazon does. So that's what I call healthcare at the speed of life. That sucked.
So you're an early adopter of CRM in healthcare, right? But it feels like sometimes the challenge isn't the implementation of these digital technologies, it's the culture shift you got to make in your practice. Does it feel that way to you?
We used to digitize everything. Then we started using EMRs and PACS, all digital technologies, what I call digitalization. But the real transformation, the real digital transformation comes from change management, getting the right information to the right people at the right time to do the right things, and making it all centered around the patient so we can actually do good for them. That's the digital transformation that you trust me to make your life better.
Oh, not great, but bad day on the golf course. Better than a good day at the office, right, Dr. Chopra? Dude, what's going on? It's our first best friend hangout in person ever, and you're on your phone the whole time.
Hey, sorry, bud, man. You know how this works. We've been so busy. You know how we talk about patient connection and being patient-centered. So the day is already flowing. I got a crazy day. Come watch us do this. See how we use all the technology we've implemented in Salesforce to see our journeys. Come hang out with us.
You let me tag along to your office?
I would love that.
Yeah.
Come on in, buddy.
Okay, we're here. It's your patient waiting room?
Yes.
Okay.
It's our waiting room when patients get checked in here, so.
Nice. So before a patient even comes and gets care from you, how do you have an idea of what they've gone through, who they are? How does it feel like you know me and you care about me? Like, how do you make that happen?
Once we know you're going to be in our universe, from the very time you get the info, we do a patient 360 on you. We'll get every bit of information we can about you. So we have your entire household, including all your doctors, providers, organizations, pharmacy, etc. We do it all on Salesforce. All your events are tracked on the timeline. We have it all tracked right there. All the other information from any EMR, etc. We bring it all in one spot. It's a source of truth. We know everything about you, including your picture right there.
It's amazing how much has gone into someone's care before you've even administered care. I'm curious what this all looks like when, like, hypothetically, I'm getting some care from you.
Let's show you.
All right, you lead the way.
Got enough gel?
Yeah, seems about right.
It matches your shorts, your tie.
I really do like my new blue paper pants. Thank you for these.
You're welcome, my friend.
So, as a private healthcare practice, you obviously have an EMR.
Yes.
Okay, as any private healthcare practice does. But why do you have Salesforce also?
So EMRs are designed as a medical record primarily for the encounter and some billing, etc. It's not designed to engage patients. So we use the CRM like Salesforce to nurture relationship with our patients, get a 360 view, but also for providers, payers, vendors, and it's morphed and grown into a platform where it's a single source of truth, and anybody can see it in the entire organization, all centered on the patient.
Well, as much as I've enjoyed this fashion statement, I think I'm ready to get out of these and get a little cleaned up and get on the post-discharge journey that I think you're gonna put me on.
Awesome, yes, absolutely. Get yourself cleaned up. I'll see you out there.
Cannot wait. All right, sadly, it's time to discharge me, and I'd ask if you're gonna send me a letter or something, but I don't think I've seen a single piece of paper the entire time I've been here. So what's the plan to kind of keep in touch with me going forward?
So we're fully digitally transformed, and so we'll be sending you emails, you'll get phone calls and things like that. You can chat with us, live chat, etc. And all this is from our Salesforce platform. But the most important thing is for millennials like you, we'll be texting you and you'll text us back. You can text it with kind of the general number of individual providers and care managers, etc. But the whole important thing here is we are centered on you as a patient. You're the center of gravity for us. We want to invest in your success. We will all collaborate for your success, and that's just what we do.
Dr. Chopra, thanks so much for having me out. It means a lot.
Pleasure,
We've known each
pleasure.
other for 4 years, but we got to meet today, took some swings, saw a patient journey before, during, and after care, and I appreciate you having me.
It's an absolute pleasure. Sorry couldn't fix your slice. Checked your legs out a little bit, but next time we'll fix your slice. We'll catch up soon.
So I'm invited back?
100%.
All right, man.
See you soon.
That means
Take
a lot.
care. My pleasure. Take
right,
care. We'll see you
ya.
soon. Take care. Bye.
Thanks, Jason. Don't forget to waggle. And Dr. Chopra, you definitely are my spirit animal. And now, here with her predictions on the future of healthcare from anywhere, it's Lynn Zaladonis.
We are in the midst of a from anywhere world. Think about it. Shoppers, they shop anytime, anywhere. Social, mobile, and of course in the store. and businesses are no different. Manufacturers of the future, if they want a part, they'll just 3D print it anywhere, anytime. In one industry where we saw that shift most acutely was healthcare and life sciences. With COVID-19, we saw a massive increase in virtual care, telemedicine, remote monitoring, pharma delivery, and that's not stopping. Virtual healthcare spending is going to increase 7-fold by 2025. This trend isn't digital only. I mean, come on. You can't get these chompers cleaned over Zoom, right? Even before COVID-19, we saw the trend emerge where more healthcare was being delivered at home, online, or at retail centers, like this Walmart that I'm here at today. In 2020, Walmart launched Walmart Insurance Services, offering health plans through Medicare. And then in 2021, they announced their plans to operate 4,000 healthcare supercenters. In the future, you're not only going to be able to pick up some paper towels, but also get a dental appointment all in one stop. Innovative technology companies like Amazon, Teladoc, and Salesforce are getting in the game, investing heavily in making virtual care a reality. But there are immense challenges with having virtual healthcare happen anytime, anywhere. On one side, the consumers of the future want convenience, flexibility. 75% of them also said they want personalized health experiences at home, in person, or on the go. And on the other side, these teams of individuals from the pharma companies, med device companies, and providers, they have mountains of challenges to try and deliver on this actual virtual experience. They have to connect tens of millions of data, digitize systems, and all the while invest in healthcare. We are actually seeing the future unfold. And that's why it's my innovation forecast that winning companies will lean into these trends and align their businesses to the customer of the future so that their business can thrive anytime, anywhere. I'm Lynn Zaladonis, and this is my innovation forecast.
Thanks so much, Lynn. And while you're there at Wally World, do you mind grabbing me a 3-pound bag of dehydrated marshmallow bits? I swear they have everything there. And now to close us out, let's go ahead and hear from Jujar Singh with the MetaPoint.
Healthcare is getting transformed in ways that are truly refreshing, whether it is a virtual care, a key care delivery model, or the focus on holistic patient. Behavioral health issues are truly endemic, and we need a concerted effort to address this problem. Physical health and mental health are not two separate things. They are closely interconnected. Primary care delivery today is disproportionately focused on physical health. The failure of primary care organizations to act as an early warning system for behavioral health issues has resulted in an overburdening of the emergency departments. They in fact struggle with placing these patients in the right care settings, and then the patients are often back to square one after leaving the ER. What if care managers at ER could easily access a network of care providers such as inpatient behavioral health facilities, social workers, transportation agencies, and other facilities to do a proper step down in care of these ER patients? My belief is that digitization of healthcare delivery process can play a significant role in behavioral health. Digitally delivered behavioral health assessments, process automation to drive the right inferences from these assessments, and guide next best actions will truly reduce the friction in the process. There is a correlation between social and economic barriers to healthcare access and behavioral health. Instead of just clinical scores, we need a holistic patient index that's not just a number, but also drives meaningful action and interventions that are personalized to each patient. Finally, we all know that most behavioral health conditions are chronic, and many of them are lifelong. Healthcare organizations need to have processes in place to deliver on the vision of true longitudinal care and patient engagement. Health conditions like autism require very detailed history documentation to ensure that the right diagnosis is made and the right behavioral interventions provided to the patient. What if a caregiver could use the patient portal not just to review their bills, but to actually share the development journey and the life history of their child with the behavioral health care provider? our technology infrastructures are definitely not there. We need a complete pivot in this direction, but focus has to be on holistic patient health and not just behavioral health. I'm Jujar Singh, and this is the Meta Point.
Okay, and now it's time to say goodbye. But first, thank you to all of our Industries TV guests and contributors today. We appreciate your time and expertise. Second, stay up to speed on all things Industries TV by following us on Twitter at Salesforce Industries. And see that subscribe button down there? Go ahead and give it a click to get all of the latest Industries TV episodes when they drop. And if you send those episodes to 5 of your friends, you'll have good luck for a year. Nope, that's not actually how that works. That's a chain letter. As always, thanks so much for tuning in for Industries TV. I'm CG Adams, and we'll see you next time.
Holy, you broke a glass on the Tesla. Let's go, man. You're gonna get me in trouble.